Abdominal adhesions in physical therapy. Now, this is a question that we always get, and people have a hard time understanding exactly what it is that PT can do for abdominal adhesions. Now, whether it's something that was related to post-pregnancy, maybe there was a procedure or surgery that was done that left some scar tissue, abdominal adhesions can end up causing a lot of other stuff, not just tightness and pain in the area, but can also cause autonomic dysfunction. So when we're thinking about it, this is my fake person here. And when we think about abdominal adhesions, so around the organs, you have like a little jacket. So like the fascia that covers the organs, right? And with trauma, with surgery and things like that, those areas develop more scar tissue, more bundles, adhesions. And the way to treat them is you have to find out, okay, one, where is the area at? So it may not just be on the scar. If this scar is like right down the middle and there's an adhesion over here, depending on the way the fascia was pulled, it might have been pulled more so to one side, causing adhesions on the area where everything was kind of shortened on. So the idea is if we start to lengthen that area or address the abdominal issues, it'll allow the fascia to be more in a neutral position, so it's not pulling on any organs or pulling on any other structures, whether the fascia is related to the muscle or the fascia is related to the organ. So we use a technique called visceral manipulation that we use to identify what areas fascially are causing the abdominal adhesions as a way to address really what's going on in the body. So if there's something on the right upper quadrant that we're trying to address, let's say a little bit might be muscle, but maybe it's the fascia that's covering the liver. And we want to make sure that that fascia that's covering the liver has extensibility, or that it's loose enough to where everything falls more midline or sits where it needs to sit without anything tugging or pulling on different areas. Now, if we have another scenario where there's a surgery, let's just say right down the middle, and we notice that maybe it's on both sides. So it's not really set to one side. It could be on both sides, one side, it can be in opposite directions. But the idea is, by us being able to use our hands and feel on which areas are more restricted, allows us to be able to identify how to start addressing abdominal adhesions via hands-on treatments. So that's a quick general synopsis of how we treat abdominal adhesions. And if you have more questions about that, we'll be putting more videos specific to visceral manipulation and how that can help you.